Hello and welcome to the 1% Solution. Here you'll find tips and tools to help you acquire more physician clients one small step at a time. I'm Dr. Vicki Rackner, your host. This week I'd like to offer some tips for preparing for the new DOL Fiduciary rule. I know that there's some concern about whether or if it will ever be implemented, and some people are looking at it as a monster. I have compassion. After all, physicians went through this very same transition about 40 or 50 years ago. In 1965, when LBJ signed Medicare into law, there was still a father knows best mentality. Doctors were thought to know more than patients, so they made decisions for the patient. In fact, if doctors thought the patients were too fragile, they even kept a cancer diagnosis from them. In the 60s, with all the empowerment movements, patients said, "It's our bodies, we have the right to choose." We saw a transition from paternalism to a respect for patients' autonomy. So the big question, how do patients make informed choices for themselves, especially in the face of an uncertain future? Well, there's a process called informed consent. The doctor's job is to lay out the risks and benefits of their recommended intervention and then the alternative. It's the patient's job to make the right choice for them. As in both medicine and investing, there are no right choices, but there are choices that are right for an individual. What happens, however, when the patient's best interest and the doctor's best interest are at odds? Patients trust that doctors put their interests first, but that doesn't always happen. There was a notable case about a cancer doctor who prescribed $35 million worth of unnecessary chemotherapy to patients who didn't even have cancer. Investing choices are as nuanced and complex as medical choices. What if you were able to help your prospects and clients sort through the alternatives in a rational, reasoned way? In other words, you help them through informed consent. And that's how I see the new DOL fiduciary rule. I believe that trusted fiduciaries are going to be the winners and non-fiduciaries are going to be the losers. I also have compassion for how difficult this is for experts to make this transformation, but I think that that's where we're going. Here are some tips that I've learned over my surgical career that help me take better care of patients and avoid lawsuits. First, I recommend complete transparency. Be absolutely transparent about how you are getting paid and how the client benefits from what you are suggesting. Second, document meticulously. You might even want to capture the encounter on video. Third, have faith in your prospects and clients. People really will make good choices if you lay out all of the options. Respecting your client's autonomy just is a good idea. It's going to support practice growth, and in the future, it could prevent fines and lawsuits. This week's tip is prepare for the DOL fiduciary rule. Treat your prospects and clients like you like to be treated when you're a patient. Well, thanks for stopping by. I hope that you found value in this content. Please feel welcome to share this with your friends, your colleague, your broker-dealer. If you've been sent this video, I invite you to go to Targeting Doctors and sign up to get on our mailing list. Thanks again. See you next week.